He gave me some medicine to dry up excess fluid, so I've been taking that.
Okay,
Wasn't that Gainer?
Yeah.
that was Gainer.
Oh, I'm sorry, that was Gainer. Yeah,
That
I'm
was a
sorry.
CSF pocket, yeah.
Cofton told me that he found another little,
Tiny, like
tiny
he sent me a
thing,
picture
yeah.
of it, it was tiny.
And he, at first he was just gonna watch it, but then after talking with the radiologist, and I guess maybe after talking about the other thing too with the nodes, they decided to go ahead and,
I would treat it.
yeah, that's what he said.
I
He
wouldn't let
wanted to-
that, cause like it was there, I mean like, honestly, it's really subtle and it's hard to see, but like when they pull it up, it's like, okay, well, you can find it.
So the 18th is when I'm scheduled to get that zapped.
Perfect. So, the PET really just shows kind of, let me pull it up here, cause I wanna show you the actual pictures. I think pictures are worth 1,000
Randy,
words.
you come look at the pictures.
I think pictures are kind of worth 1,000 words when it comes to, rather than just explain things, but they see, those little nodules in the lung that might be, like I said, post-viral, that are not hot. And then these kind of abdominal and retroperitoneal lymph nodes that like are 2 by 3.2, which they said, previously 2.2 by 3.1 when they compared it. So they actually measured it a smidge smaller, but I don't know that that's not just measurement technique, frankly. The problem is like immunotherapy can cause your immune system to make lymph nodes swell because you're stimulating the immune system so lymph nodes can swell. The problem is that they're swelling in the pattern that I worry that bladder cancer tracks. And so it's like, is it because there are some tumor cells that are there that like they're attacking it, or is it because that's just tumor there? But those are the nodes, like right here and right here, and they're in the back of the belly.
But they're glowing on there.
Yeah, they're bright. They're definitely bright. This is not tumor. That's just bowel activity, and this is just.
What is that?
That's a little node right there. The problem is the glow always makes them look a lot bigger.
Yeah,
Because like if you actually look at the CT correlates of that,
they're small.
well, they're not. I mean, the glow extends beyond the amount of like actual disease. So I talked to Dr. Covton because I have radiated people up that high, because technically those nodes are out of field. Like if you showed up with that de novo, meaning like the first time you showed up in my clinic, first time you were diagnosed, I would say technically those nodes are metastatic nodes because they're higher up in the belly. They're not like right next to the bladder, okay? So generally for that we would do chemo first, and then if it behaves well, then we think about radiating up that high. But we don't generally go chemo radiation like you got up front when it's that high, because that's kind of outside of the field. And the reason I bring that up is because I already asked the question to him, being that it's higher up than a normal bladder field, would you be willing to consider radiating, that space? Because they don't overlap radiation. Like they don't like to go back to where you were previously treated. He said
I'm glad, because I had a lot of diarrhea when they did that.
He said it could get tricky because, the fields might overlap a little bit and stuff like that. So he kind of favored me trying to treat these down and make sure the brain's controlled and everything else before we would do anything locally aggressive, because we know it's already gone to here. So treating this super aggressively may make sense in time, but in the short order, like making sure we have global control is probably more important.
Yeah.
So.
Wouldn't having global control, wouldn't that treat that anyway?
Yes, 100%. So, we're in a little bit of a tricky spot because, you got a few cycles of the pembrolizumab, the Keytruda.
Yeah.
Now we see this stuff, unclear if that's related to giving the medicine or if it's related to tumor developing on the medicine. One is obviously much worse than the other. There's new data that came out within the last few months of people that have, clearly visible disease, that we can do Keytruda plus this drug called enfortumab vedotin. But, it's unclear, since you've already had the Keytruda, should we add the enfortumab to it? Or do we, go to chemo, that'll treat everything too. How did you do with the chemo piece when you got the radiation?
I did fine with the chemo. It was cisplatin. I don't recall really having a problem with the chemo.
Okay. I would probably lean to that and save the enfortumab, honestly. But I mean, I think the big question here is do you want to try to biopsy one of these lymph nodes before switching, which is what I would lean towards.
Yeah,
I mean, just to be sure, because then we can also
yeah, I
send
would rather you know.
We can, I'm concerned, but if we get it and it's all just inflammation from immunotherapy, well, that's the best case, and I'm not gonna sit here and say I'm sure that's what it is, because I'm not.
Right,
But if it is, that's good, we continue, and this should, if it's inflammation doing something, it should actually decrease over time.
well, I've had a lot of inflammation, but then I've had COVID too, and so COVID makes you have a lot of inflammation.
Yeah, I also, though, I would expect COVID nodes to be in the chest more so than in the belly, so I'm more worried that, I think the options are basically that there was either tumor in those lymph nodes hiding out that we couldn't see on a CT because it was microscopic. We unleashed the Keytruda, the immune system attacked, and now they're swollen and bright from the Keytruda attacking. Or tumors growing despite the Keytruda. I think it's probably one of those two things, frankly.
That's the bad one.
Well, I don't want it to be that, but I mean, I have other good options, so I'm not gonna sit here and say it's the end of the world, but I think defining that is really important, because I never wanna abandon a therapy if it could potentially be working.
Right. Yeah, I saw that I looked online and there are other immunotherapies to fall back on.
Yeah, it's just hard to say, like, oh, this one didn't work, let's go straight to an immunotherapy, because like, they do work a little differently, but they're not markedly different, and so, I think biopsying this would be
Okay,
prudent, because we would even get more, because I know you had your surgery, and, I mean, your debulking surgery before the chemo radiation, and you can test that piece of tumor, but like, this is tumor that was kind of quiescent for, assuming this is tumor, but this was quiescent for,
yeah.
since
So we're
treatment.
still not even really sure if that's tumor or just,
That's the point of the
That's
body.
the point of the biopsy, yeah. I mean, it seems backwards a little bit that like you had disease show up in the brain before disease show up in the body, so I just wanna check and be sure.
okay. So how invasive of a surgery would I need to have? I mean, if that's tiny.
So I'm hoping that they can stick a needle.
Ooh, okay. A needle, that doesn't sound too
I'm
bad.
hoping they can needle this,
Mhm.
like, maybe like right through here.
Through my back or the front?
This actually might be a better posterior approach, cause you see like the ball is right here,
Mhm.
so you might go right through the muscle right there.
Just don't let them perforate a bowel.
Oh, I know. Well, the good news is those needles, even if they put like a tight on needle hole in the ball, that fixes itself, cause the needles are so small. But yeah, I need to make sure that the guys, feel comfortable that they can get to it, cause I really don't wanna open you.
Mhm.
And I really don't wanna be we don't wanna be giving you chemo in the interim with him planning to do stereotactic, gamma knife. You don't want chemo in your system for that, so this is a time where we.
So that's why they always ask me if I've had chemo and when.
So I think right now we say, look, we gotta define this better. Even if I knew this was tumor, I would say having a piece of it would be helpful because of all the next generation sequencing, the 650 gene assays, because this is behaving differently than the old tumor did. It was quiet for a long time, and now all of a sudden if this is tumor, it's there, and so we need to understand why.
It's so weird that all those checkups at the Metairie she got on her bladder, she said how healthy her bladder was and everything.
Yeah, the bladder
Yeah,
itself
those-
looks like a healthy bladder on the
That
inside.
stuff was still in her body, all that.
Microscopic, that's the problem.
Oh.
Well,
below
they
the-
told
below the
me when
devil.
I remember I said, oh, that means I'm cancer-free. And I remember him saying at one point, well, we can't definitely say cancer-free. There could be some microscopic something. That's why they did the immunotherapy, was to kill microscopic, but apparently some.
I wonder why they didn't do that blood test sooner.
I wish they
See if
had,
it
yeah.
been in her, if they found that in her blood.
Was that even around back then?
Cells.
It was still kind of evolving. And the truth is we don't even know what to do with that result, frankly. Like,
Mhm.
just because it's positive, it doesn't mean that there's no data that says treating a positive without evidence of radiographic disease is useful.
Mm.
So I think people have been slow to adopt.
It's
but-
so new.
I know it's all new, but the good news is new things keep coming out. So
Yeah. Help,
I
help
think-
future cases.
I know. What I think I would do is, you got your gamma knife on what day you said? The 18th or the 16th?
18th.
18th.
Mhm.
So I would let you do that. I would get the biopsy between here and there. And I would just kind of keep you on schedule for the Keytruda on the 23rd, and we'll get it done and we'll have the biopsy results and we talk about, where to go from there based on that. Good news is I'm not seeing a bunch of disease elsewhere. I mean, I'm seeing what we had known was there from our last.
Good, good.
What,
That is
what
good.
all parts of the body did that PET scan cover? From top of the head to,
Mid-thigh, skull to mid-thigh.
okay.
Yeah. It didn't cover my arms because I lifted them up when I realized I had my watch on.
No, that's okay. No, you don't worry about tumor going to distal arms. It can get to like biceps,
Yeah,
but
I didn't
those
get the
get
arms
caught because
back.
they're not biceps, but humerus. But those get caught because they're,
I was
they're
just
under your
trying to
head.
get my watch out of the way.
Yeah, that's okay. But I think let's work to get that done. I want one guy in particular probably to look at doing the biopsy, okay?
Okay.
Because I think there's one or two interventional radiology guys who do those biopsies that are probably
We want the best.
Yeah.
a little more
I just-
technically skilled.
Biopsy just, that whole idea scares me because every time they've told me they were, oh, I'm sure this is gonna be good. Every time,
Been
then it
something.
came back, worst case it seemed like.
Yeah.
Isn't that the truth?
Yeah, you've had a weird case lately ever since the brain stuff, but we just gotta define everything, because I tell everybody information is power. The more information you have, the better decisions you make. So I think it's a good that I don't see more,
Yeah, that's good. I still feel like it could be lingering COVID because everything I have, my daughter had after having COVID,
At the same
and
time,
so
yeah.
did another girl that I work with.
Mhm.
Had after having COVID, like this nausea and continued tiredness and taste messed up. I've had taste messed up. Diet Cokes taste horrible now, and I love Diet Coke normally, but everything with carbonated water in it tastes bad.
bothers you. Okay.
So I'm convinced I have some kind of lingering COVID stuff.
Yeah, you could, but no, let's try to define this, because if the needle says no tumor, that's a good thing, as long as they say they were in a lymph node. I mean, if it says just kind of scant, like tissue, it's gonna be like, oh, did they miss? Because that's not the easiest, it's not the easiest place in the back, but if it says, lymph node with inflammation, well, that
Okay,
tells us
so
something.
it does
If it
have to
says
show that it's lymph node.
urothelial, yeah, because if it doesn't show there's lymph tissue in there, it makes me think they,
They messed up.
I don't want to say messed up, because I don't want to sit there and say that
It's so
these
tiny.
guys are trying to send a needle through this
Yeah.
much tissue to get to some structure
Yeah.
that's around blood. It's
Yeah.
it's got some nuance to it.
I
Otherwise, I would do it
understand
for you.
that. When I went to Gaynor, I was disappointed when he prescribed the medicine because I was hoping that he could just stick a needle back there
Drain
and
it.
drain it. He said, well, if I just stick a needle back there, I could hit your spinal cord. I was like, oh, okay. He said he would have to have a CT scan and be all, all this
All at the
stuff
same time,
yeah. I'm like, oh, okay, I'll try the drugs.
Yeah. But let's get that done and we'll kind of regroup, okay?
Okay.
All right.
So I'll hear from you
We're,
about.
my lady Elise is going to call and try to set it up right now.
Okay,
Yeah, she'll call the hospital and try to get it done.
okay. And that'll be fast, it sounds like.
Usually
huh?
you can usually get them done within a week.
Okay.
But if we can get it
But I
within
mean, once they schedule me, it won't take, the procedure itself won't take that long.
20 minutes maybe.
Okay.
Because they're probably gonna look at the scan and like watch the needle go and try to make sure they see it go in. And
Mm-hmm.
it's pretty neat. The images I can show you after it's done, you can actually watch the needle go through the skin
Mm.
and into the, target.
Yeah.
So, all right, well, let's work on it.
Okay, well,
All
very
right, ladies,
good.
hang in there, okay?
Thank you so
All right,
much.
all right,
Appreciate it.
all right.
So, yeah.